Well, I like the way that the new safety plan came out. I worked on, and then I also did on the opposite side of that, um, um, mental health resources, and made a file so that people easily could send that. So everyone's been liking that it's update with new information and stuff. So said that that's been going well with getting that easily to patients. But something I am really encountering, other people are encountering too, is given that we're a mental health clinic, a lot of times people are here because they're have a suicide attempt a long time in the past. And these are often patients that I see often. So I'm seeing them often and they're all like, we did this last month. And I have to admit, like, the first two questions are fine. I think everyone's used to doing a suicide assessment on this patient population, and asking about self-harm and harm to others and suicide. That was never an issue, and it was always about the safety planning. But that always goes to question 6, which is we just talked about last week. It's like, so it feels a little like patients are like, it feels a bit redundant, because question 6 is, have you ever done anything, started to do anything, or prepared to do anything to end your life? And often we have just asked that question and did like this big long intervention. And so I think as a group, we're trying to figure out like, well, that doesn't feel like exactly right to ask. It feels right to ask everybody, but like after a while, like if you're seeing someone every month and you know that they made a suicide attempt when they were younger, it's just like, what part of I think that they feel like it's a little bit redundant and a little bit like not as meaningful. So just thinking about that a little bit and what that means for like, and maybe just gonna look at the research a little bit on what people do in that situation when they keep seeing the same patients. Like with the PHQ-9, we just keep asking it, and that's just part of the process. And maybe there's enough evidence that suggests this should be part of the process, and even if it feels a little redundant. All right.